Hi, my name's Lauren, and I'll be running you through what an acute spinal cord injury is, how it affects the lives of people who have it, and recent advances in pharmacological and other therapies of SCI. The spinal cord extends from the lower part of the brain to the bottom of the back. It is a long bundle of nerves and cells and carries messages to and from the brain and the body. The spinal cord transmits the nerve impulses of pain, pressure, sensation, movement, temperature, and more. Acute spinal cord injury is a traumatic injury that bruises and/or partially or completely tears the spinal cord. SCI is a common cause of permanent disability and death in children and adults. There are two main types of spinal cord injury. A complete SCI causes a complete loss of sensation and motor function below the level of the injury, and an incomplete SCI occurs when a patient is able to feel some sensation below the injury site. The World Health Organization estimates that every year around the world between 250,000 and 500,000 people suffer a spinal cord injury. Around 12,000 people in Australia have an SCI, and 84% are male and 16% are female. The age group that records the highest number of injuries is the 15 to 24-year-old bracket. Many things can cause an SCI, and most are preventable. Causes are often a sudden and traumatic impact on the spine that can break, fracture, or dislocate vertebrae. The most common injuries happen when the spine or neck area is compressed or bent. Events such as falls, motor vehicle accidents, sports injuries, and violence are among the most common. Spinal cord injury is a case-by-case condition as the severity and location of the injury dictates the effects of the clinical outcomes. These outcomes can vary from a partial to complete loss of motor and/or sensory function in the areas below the level of the injury. The key pathophysiological events that occur after an injury are intricate. Secondary injury will start in the first few minutes following the initial injury and will continue for many months after. Specifically, a secondary injury is where a series of molecular, cellular, and biochemical mechanisms constantly self-destruct the spinal cord tissue and inhibit neurological recovery. Secondary injury can be temporarily divided into acute, subacute, and chronic phases. The impacts on the livelihood and life expectancy of patients with an SCI vary as well. The financial cost of a person with an SCI is very high at an estimated $2.35 million lifetime cost, the most expensive of these costs being for surgery, rehabilitation, long-term care, and medical equipment. Ongoing medical complications and a significant loss of mobility and participation have been shown to be the consequences of an SCI. Mobility can be impacted with varying degrees according to the type of SCI, with some patients losing all control from their neck down to others losing control of just their legs. A person's mental health is also affected by an SCI, with the development of anxiety and depression being normal reactions to the physical change. SCI has been found to initiate chronic brain neurodegenerative responses, which are thought to relate to a delayed and sustained induction of M1 type microglia and its associated cell cycle activation. Current studies have shown that SCI causes widespread and constant brain inflammation in the thalamus, hippocampus, and cerebral cortex. Specifically, SCI causes chronic neuropathic pain associated with inflammatory changes in thalamic pain regulatory sites. This brain inflammation then results in progressive nerve loss and can result in cognitive issues and clinical depression. Through employing pharmacological therapies, further complications like autonomic dysreflexia can be controlled, tissue repair can be initiated, and a preservation or even restoration of function can be achieved. Medicines include second-generation anti-epileptics, opioids, benzodiazepines, and glucocorticoids. Pharmacological therapies target pain, spasticity, and inflammation. There are limited treatment options for spinal cord injuries. Some options include exoskeletons, peripheral nerve spinal bridges, stem cell treatments, and neuroprosthetic system implants. To limit damage to tissue after a primary injury, medical professionals use surgical decompression of the injured spinal cord as the most effective clinical treatment. A trial in human stem cell therapy has been recorded to induce spinal cord regeneration in animals. This study showed that inducing spinal cord regeneration after severe spinal cord injury is possible in animals. However, a full recovery from a severed human spinal cord has not been achieved yet. Epidural stimulation therapy is where a stimulator is implanted into the spinal cord and can be remotely activated by the patient. When the implant is on, a constant electrical stimulation connects the targeted muscle to the brain impulse. The promising results have previously paraplegic patients regaining leg movement. Some great research has been conducted over the past decades, but the momentum must not taper in coming years. Thank you.